September is Suicide Prevention Awareness Month, but the need to talk about mental health and suicide prevention is really something that lasts year-round. Every year, thousands of families are impacted by suicide, a tragedy that is so often preventable. So joining us today is Tina Hoffman, who teaches a suicide prevention class through Franciscan Health. Tina, thank you so much for being here.
Thank you for having me.
So this is a difficult but really important conversation because it affects so many people, really in every community here in Indiana, around the country, and around the world. Why is it so critical to talk openly about it?
It is so hard, but let's talk about the fact that in 2023, 985 men died by suicide in the state of Indiana alone. We don't want to talk about it because they're afraid. The stigma is still so hard. If we talk about it, we have to do something about it. But we're also afraid that we're going to plant this seed. And it is not a problem-solving solution. Me asking you about suicide does not mean I am problem-solving for you. It means I see your pain and I want to have some hard conversation about it.
What are some of the warning signs that someone is showing that they may be struggling or thinking about suicide?
There's so many warning signs. A lot of times we feel withdrawal. We hear that they stop texting, they stop talking to people, their families. Maybe they're not showing up for work on time. Maybe they're not going to church. That withdrawal because they're having such mental anguish. They're feeling that they don't have an avenue to help support or someone supporting them. And so they just continue to withdraw because they're also, men in particular, feel a lot of shame that they're even thinking about suicide.
You teach a suicide prevention course. Tell me about that. How does that work?
We teach applied suicide intervention skills training, and we teach you how to recognize that someone is throwing out those signs, and then we teach you how to ask the question of suicide. And after you say, oh crap, in your head, then we teach you how to have that dialogue on where we're not problem solving, because human nature is we want to fix people's problems. We're going to teach you how to listen for empathy, how to listen and care and hear what do they want to do. And then we work together to build out a safety plan that they are willing to engage in, because our goal is to keep them safe for now, to keep them out of our emergency rooms if possible, and to maybe, if nothing else, call 988 together and break that barrier of fear to utilize a resource later down the road. We
have so much more to talk about, so you can join our extended conversation about this right now. Go to WTHR.com/realmenweargowns. Tina, thank you for being here.
Thank you.
All right, we're going to break down the numbers.